Okay, great. So welcome everyone. Thank you for coming to the orientation session. I hope everyone's having a great start to the fall term so far. Tina and I were just talking, it went way too fast. So we're just going to do a quick overview of the Precision Health Graduate Certificate Program. If you attended the information session, a lot of the stuff was covered, so we're gonna review that quickly. And again, my name is Angie Sullivan. I'm the program manager for the certificate program. And we also have Dr. Gretchen Pyatt on the call. If you want to do a quick welcome, Gretchen, or introduction.
Hi, everybody. Good to see you. I'm Pyatt. I'm the director of the certificate. And the certificate is housed in the Department of Learning Health Sciences, where I'm the vice chair and I oversee our degree programs. So I'm glad to see all of you, and it should be a great semester.
Yeah, so and also I want to do an introduction for everyone else to introduce themselves. We have done this not for the last 2 years, but when we started the program, we did it in person, and we had a lunch provided and catered. And we're hoping to do some more in-person events this semester. So to start with, if I could, we have some faculty on the call. If I think we have Ivo Dinov, if you want to start us off for introductions.
Yes, Angie, thank you. Hi everyone. I'm Ivo Dinov. I'm the current acting lead on the Precision Health Education and Training Working Group, very closely working with Gretchen, Tina, Angie, and others. So it's great to see the new cohort of students. We go through this every year, as Angie said. And I know it is a small but very vibrant program, so we're excited. I know I'm personally meeting with a couple of you, so welcome and go blue.
All right, Beverly, would you like to go?
Sure. Hi, everybody. Bev Yashar here. I'm in the Department of Human Genetics, and I'm on, I guess, the steering committee for this group. And I've served as a mentor for the last couple of years. And I'm looking forward to not only meeting my mentee, who I know in the department, Callie, but hopefully a number of you at meetings in the future. So congratulations on getting into the certificate program, and have fun.
Great, thank you. And Tina, do you want to do an introduction for yourself, please?
Sure. My name is Tina Krager. I'm Senior Project Manager for Precision Health, and I work with the Education and Training Group to support all of the faculty activities and staff activities. So if Angie's not available, you can always contact me and I'll do my best, but Angie's really the expert.
Thank you, Tina. Okay, then we're going to do the student introduction. So I see here, Claire, if you want to just, your name and your program would be great. Maybe your interest in precision health.
Yeah. I'm Claire. I'm a dual degree physiology and public health and health behavior and health ed student. I'm interested in precision health mainly because over the summer I did an internship with the Institute of Health Policy Innovation, and my internship was housed in the Department of Learning Health Sciences, and I think the concept and potential of where LHS systems can go and how we can kind of shift HRs instead of just making it like a administrative billing tool, also extract clinical data in a way that improves quality and care is really impactful. And I think the next like big thing that's going to hit medicine. So I'm really excited to be here.
Right.
Claire, who did you work with in our department?
I work with Dr. Kalpakjian, who's also with the PMNR.
Okay. Right. Awesome.
Great. Thanks, Claire. Shreya?
Hello, everyone. I'm Shreya. I'm a second-year Master's in Health Informatics student, and my career interest lies in building health IT architecture that supports value-based healthcare delivery. And I believe this certificate will be helpful for me to achieve that.
Great, thank you. Callie?
Hi everyone, I'm Callie. I'm a 6th-year PhD student in the genetics and genomics program. My interest in precision health is sort of founded in genetics education. I think major roadblock to implementing precision health in the clinic is just basic education in genetics. So I'm hoping to pursue a career that might bring more of that to the clinic.
Wonderful. Thank you. Ariella?
Hi, I'm a 2nd-year PhD student in the Health Management and Policy Department in the Public Health School. And I worked in precision medicine prior to coming here. And my research interests are around ensuring healthcare access to emerging precision medicine technologies to make sure they don't cause further disparities. And I do research with Dr. Jody Platt and team in precision oncology and in healthcare AI.
Okay, great, wonderful. Krista.
Hi, I'm Krista. I'm a 4th-year PhD student in the chemistry department. And so my work kind of builds on works with precision medicine because we're using a sensor platform to detect varying biomarkers in different infectious diseases. And so our main project is looking to develop a latent tuberculosis diagnostic tool. And so we're using normalization of cytokine immune markers patient to patient to build out these more generalizable diagnostics.
Great, wonderful. And then Chloe, please.
Hey everyone, so like she said, my name is Chloe. I'm a 2nd-year student pharmacist in the College of Pharmacy. I guess I have 2 interests in precision health. So I really like pharmacogenetics. That's what my research focuses on. And I also took a class on informatics this past semester, and I'm realizing how important it is for healthcare. And so I really want to get to know that area better.
Great, thank you. Great, thank you everyone for those introductions. We have a nice mix of students this semester. Let's see, there we go. So an overview of the certificate program. I'm actually going to ask Dr. Pyatt to review the creation of the program. She was part of that work group that was charged to start the certificate program.
Sure. So in addition to me being part of that work group, also Dr. Yasher and Dr. Dino was also part of that. But basically, I'm going to say around 5 years ago, give or take, Michigan Medicine received a large amount of funds to create the Precision Health Initiative. And as part of that initiative, there were a handful of work groups that were created, and one of them was the Health Education and Training Work Group, which was charged with developing a team science approach for precision health at U of M and Michigan Medicine. And when I say team science, I mean very multidisciplinary, very collaborative, lots of different departments working together on one goal. So as part of that work group that we're all involved in, we created the Precision Health Certificate. And we thought that there was a really great need for graduate and professional students to have the opportunity to develop skills that were specific to this field. Up until then, there really wasn't any one program that covered the massive amount of content that can be fit into a precision health certificate. So like I mentioned when I introduced myself, the certificate is housed in the Department of Learning Health Sciences, which is a medical school basic science program or basic science department. And our first cohort that we admitted was in the fall of 2019. And we have admitted cohorts every fall and winter semester since. And we currently have about 23 students enrolled in the program. Now, people have also graduated during that time, but right now we have 23 students.
Yes, and I was going to mention that too. We have 11 that have completed the program so far. So an overview, just, the courses for the the certificate program that are required. There, it covers 6 domain areas. You can see here ethical, legal, and social implications of health, precision health, data science and predictive analytics, biosocial determinants of health, policy, economics, human genetics and health and disease, molecular medicine, bioinformatics, computational genomics, consumer health informatics, and healthcare systems engineering. And then also required as part of the certificate is the precision health seminars and the annual symposium, which I'll talk about. Other requirements of the program, everyone should have been introduced to your faculty mentor from that precision health education work group that Dr. Pyatt talked about. And if you haven't done so already, please reach out to your faculty mentor and do a quick introduction. There, you know, if you want to get together for, you know, meeting at their office or for coffee or something, feel free to do that. And the idea is for you to meet and learn about each other's interest in precision health. And we encourage you to meet with them at least once, but it's up to you and your faculty mentor how many times you'll meet throughout your time in the program. So the coursework. So there's a minimum of 10 graduate credit hours of coursework from at least 2 different competency domains that I discussed previously, with an effort to include all the precision health domains, which is the discovery, treatment, and health domains. And we have over 60 courses to choose from. Those are listed on our website. And then there's also, again, that 2 credit hours of precision health seminars that is required. And then also, we've had a number of students who've already taken some of those courses that are on our list, and those can be counted towards a certificate. So many of you may have completed a lot of those 10 graduate credit hours that are required. And no more than 1/6 of the credits required for a master's degree may be double counted. And those double counted rules are irrelevant to PhD students who do not seek a master's degree. Any questions on that? Just let me know, because it's can be a little confusing. The Precision Health Seminar Series. So that's designed to kind of be based around a theme. And this year, the seminar series, we've had a little bit of change of leadership, but those are in the works of being created. And we hope to have that first one out available in October. And it's usually around a theme. And I believe this year's theme is how precision health can enable greater health equity, I think is what that's going to be based around. So over your time in the program, you're going to be required to attend 8 seminars. Usually the precision health seminars, or they can be departmental journal clubs or the Learning Health Science collaboratory events. And a lot of this stuff you'll learn about those events through me. I'll send out emails. And then after each of those seminars that you attend, you will submit a 1-page double-spaced reflection focused on comparing and contrasting the seminar topic to your interest in precision health. And I ask that you email your faculty mentor when you do submit your reflection, so they can know that to go in and read it on the Canvas website. And those are typically due 2 weeks after the seminar. And we just like to put that date on there just so that's fresh in your mind to make sure you do that. So your faculty mentor is the one that reads and responds to those reflections. And again, you will take 2 credits total over your time in the program, and the actual course is LHS 600. And then I wanted to note that the annual symposium reflection is a separate assignment and requires a 1-page reflection. So you'll have 9 reflections written after you've completed the program, to complete the program. So everyone should have received permission to register for the LHS 600 for either a half a credit or 1 credit. If you registered for a half a credit, that means you will attend 2 seminars and you will submit 2 written reflections. If you registered for 1 credit, you will attend 4 seminars and submit 4 reflections for this fall semester. If you're registering for 1 credit and you haven't let me know already, let me know. And then I send that to the registrar's office, and they're the only ones that can increase you to the 1 credit. And again, that's 2 credits total to fulfill the certificate requirements. So there's also, in addition to the seminar series, there's precision health related seminars, maybe journal clubs in your home department or other departments. If you see something across campus that you think is precision health related and meets those competency domain areas, those can be considered for fulfilling your certificate seminar requirement. You'd want to send those to me, and then I'll get those to Dr. Pryatt for prior approval. And we've had students attend like a conference that they've attended, and there could be something, a session or something that they feel is related to precision health. So again, that's something that can be considered. So feel free to email me anything that you're attending or talk. We had a student do a talk, and that was counted for their fulfilling one of their requirements. And again, I mentioned earlier, I will send out these opportunities as they arise. So watch for emails from me. We have a lot of different things going on across campus that might be of interest to you. Some optional seminars that you can find that could have precision health related topics is the computational medicine and bioinformatics. And these, I'm going to send this presentation to everyone afterwards. So you can go in here and you can click on these links, and it's going to take you to their seminar page. There's the Michigan Institute for Computational Discovery and Engineering, the Michigan Neuroscience Institute, and then the Michigan Institute for Data Science. So encourage you to go on to their websites, look at the different topics that are presented on, and find an area of interest to you. And again, just send those to me. I'll get those to Dr. Pyatt, and we can look at those for approval. And then the Precision Health Annual Research Symposium that I talked about earlier happens once a year. And it's an opportunity as a student to present your own research if you like, in a talk or a presentation or a poster session, the opportunity to network with the Precision Health External Advisory Board. And if you're unable to attend the symposium due to conflict schedule, because we don't know what date it's going to be on yet, it's likely to be recorded. However, I know we're hoping for a fully in-person symposium this year, but hopefully it'll still be recorded for those that can't attend, and those details will be determined later. And again, after this symposium, you will submit a one-page double-spaced reflection focused on the symposium as a whole, or maybe there's a particular session that's of interest to you. And then you just want to talk about, comparing and contrast your interest in precision health.
Angie?
Yes.
I was just going to say, Tina put in the chat that the 2023 symposium will be March 15th.
Perfect.
So if folks want to mark their calendars now, that'll be an in-person event.
Yeah, wonderful. Thank you. Thank you, Tina. So last year, the March that took place, it was a hybrid session. So some people were in person and some people logged on. And that was on advancing responsible healthcare innovation using artificial intelligence. So that was the theme of the conference. So again, we're hoping for another great symposium next year, 2023. Optional requirements and opportunities. There's attendance at other non-credit networking activities are encouraged, but not required. And that can be meeting with other students at seminars. Again, we're hoping to have more in-person seminars, meeting with guest speakers when they're available, and any opportunities as they arise. Again, I will email those out. And I really encourage you to go to the Precision Health website. And on that page, you can sign up to receive the newsletters as they come out. And they often have lots of announcements and different sessions. And I know I just received one the other day, and it had a ton of stuff on there that you could look into for upcoming things that are going on over in Precision Health. And again, when I send this out to you, click on the link, and then you can see where to sign up for that updates. I will do communication via Canvas and email, and everyone should have received an invitation to the Precision Health Canvas site. If you have not, let me know. And I'll just send out announcements, assignments, and those different seminars as they arise. So watch for those announcements from me. And everyone should have received an admission notice from Rackham. If you go into your account and you see that you haven't been admitted officially, it could be due to a conditional admit or a delay deferral, which you can find on your student and business account. So if you log in and see that you haven't officially been admitted, I actually was trying to check that today, but our system is down in Pathways, so nobody's able to access the student information right now. But questions, you can contact Rackham Admissions, or again, reach out to me. And that's all that we had for today. So we want to open it up for questions. And if anyone, I'm going to stop sharing here. There we go. Perfect. So I'm going to open it up for questions now.
Can I ask a question about the seminar series?
Sure.
How many seminars are typically planned per semester?
I mean, precision health seminars or just all seminars?
The precision health seminars, yes.
Jump
That's
in if
hard-
you like,
That's
Gretchen.
hard to say. Yeah, go ahead, Tina.
I think we'll probably have 5 in the academic year this year, so plus the symposium.
Great, thank you, Tina. And I was just gonna say that, you know, I send out a lot of different topics that are throughout the year. So there's a lot of variety for you to choose from. So I don't think you'll be lacking as far as options. And Gretchen, you were gonna say something?
No, I was gonna say the same thing. It looks like Ariella has her hand up.
Yes, I was wondering, so when we applied, we submitted either a plan for courses that we've already taken that we would want to count, or future courses we would count. What's the process for, I guess, do you guys approve that, or do we communicate about that, or how do we track that?
So I would communicate about that with your advisor. They will know, you know, whether those courses that you proposed meet fall into those 3 domains, and then the 6 different concentration areas. And if there's any questions around it, you know, they'll come back to me or Angie with, you know, maybe they need a suggestion on something else for you to take or something like that. But for the most part, just work with your advisors to make sure that what you're planning to take is going to meet the requirements, and also that you're not double counting too many things.
As far as, and again, if it's not related to a master's program or degree, then that's not relevant, right?
Yeah, so why this becomes an issue is because, for example, people from our department, from the Department of Learning Health Sciences, they often run into this because, you know, we have a curriculum that master's and PhD students take. And if they decide that they're going to get the Precision Health certificate, we actually have all of our courses as courses for the certificate. So, excuse me, they can only count basically 3 credits of what they've already taken.
Yeah.
So it depends, I think, on a lot on what department you're currently in.
Okay.
So for HMP, I don't think that there's a ton of HMP courses that we use for the certificate.
Yeah. Okay. Thank you.
Go ahead, Claire.
My question is more about like general advice. So the Precision Health has the 6 categories, and they're all like quite different. So how would you balance like exploring what each of those categories like has to offer versus like aligning it with like your specific career interests?
Yeah, that's a good question. I mean, and I'd be curious to hear what Bev and Evo say too. I kind of view the Precision Health certificate as a way for you to supplement your career path. So as someone who is getting a degree in, or you get your dual degree, right? HBHE and remind me of the other one?
Physiology.
Physiology. Okay. So as someone getting dual degrees there, I would think that you might want to supplement your knowledge base with maybe courses in advanced statistics or analysis. And I'm just talking off the top of my head. I don't, not telling you to take them. So I think I view it as a supplement to the degree, rather than trying to fit what you're already working on into one of those categories.
Yeah, I guess
Claire.
I guess I'd agree. I mean, I think I've had lots of different learners over the years, and a number of them have tried to find something that's complementary, right? As opposed to going deeper into the area you're already interested in. So kind of building a little bit more for the future of where you want to go. But I think it really depends on, where your starting point is, because there's a lot of variation among the cohort.
Right.
Claire, this is Ivo Dinov. I was just going to chime in to dovetail on what Bev and Gretchen just mentioned. The most important thing is, remember, in addition to complementing your existing degree programs, you should keep in mind that some of the classes that you may choose may or may not be available during the semester that you intend to take them, or they may be oversubscribed. So it's an interesting dance that you have to go through. I mean, just look at the courses that we have listed. If none of these is appropriate and complements your existing curricula, then talk to either of us. Any one of us should be able to find additional courses that you can consider. And ultimately, it's a little bit of your responsibility to figure out, you have the prereqs. Some classes are just going to have, tough prerequisites to meet. Some classes, again, as I said, I don't know, instructors do go on sabbatical, so a class may not be offered this year or something. So there's a lot of moving parts, but it's really good to hear that you and others have taken the step forward to grow your career trajectory in, let's call it, non-traditional ways. So that's wonderful.
And I also wanted to mention, I may have mentioned it during the presentation, is if there is a course that you want to take that's not on the approved list, you can send that to us and we can review it to see if it meets those precision health or competency components.
That happens all the time.
It does, yeah. Yeah, our list is getting very large of approved courses.
Any other questions we can help with before we wrap up? Okay. Well, with that, welcome everybody. Welcome to Precision Health.
Yes, and watch for emails from me. I'll send you out the first information about the upcoming seminars when we have it, and anything else that comes across my plate, I will forward along to everyone. Okay. All right. Thanks, everyone.
See ya.
Thank you.
Bye-bye.